Hello, I am Dr. Harsha Reddy. I am consultant obstetrics and gynecology. I practice in Cloudnine Hospital, Sarjapur branch and the Bangalore branch in Bangalore. HIV, the full form is human immunodeficiency virus. Now, if we have a mother who is pregnant and is tested positive for HIV, the prenatal care is as a routine care for any pregnant woman, with an extra emphasis given to have regular consultations, not to miss her consultation, and to focus on her nutrition. Now, beyond that, because the mother is positive, there are certain other investigations which we would like to do. One is to look for other sexually transmitted diseases like hepatitis B, syphilis, chlamydia and gonorrhea. We do the blood test, the serological test for cytomegallo virus and toxoplasmosis. And we also may have to test for tuberculosis, and we test the husband or the partner for HIV. Once this is done, the couple counseling is done and emphasis is given about the need to start the treatment and need to be compliant with the treatment, and we explain the risk of transmission to the baby, which varies from about 14 to 25%, and about the breastfeeding as well, which I will be talking to you later on. And we need to assess the progression of the disease, that is the HIV itself. We do this by looking at the HIV viral RNA load, and we regularly monitor the special type of white blood cells or WBC, which is called as CD4 T lymphocytes, and this is done every 3 to 4 months. Anti-retroviral treatment, ART, the HIV medicines, decreases the viral load in the mother as well as reduces the risk of transmission to the baby. So it's very important to treat the patients who are pregnant with these kind of medicines. These medicines include nucleoside analogues, non-nucleotide analogues and protease inhibitors. They have to be started early and taken regularly. It has to be taken before the labor, during the labor and even after the birth of the baby. Now coming to how do you prevent a maternal to child transmission. As I mentioned, the transmission rate really varies anywhere between 14 to 25%. As soon as the woman goes into labor and if she is opted to have a vaginal delivery, the same HIV medicine which we were giving to be taken by mouth can be started by an intravenous route, and if she is opted for a cesarean section, it has to be given at least 4 hours before starting the cesarean section. It has to be continued during the course of labor till the umbilical cord is clamped, and the umbilical cord has to be clamped and cut as early as possible. Opting for an elective cesarean section would be a very good advice which we can offer to these women, because this decreases the chance of vertical transmission by about 50%. And if we combine an elective cesarean section along with the HIV medicine, it decreases the chance of transmission to less than 2%. Now, once the baby is born, the baby is also going to be given these medicines, and which has to be continued in the baby for at least 6 weeks of life. And the baby has to be tested regularly to see if it has acquired the infection from the mother. In cases where the HIV viral RNA load is quite high, or the WBC count which I mentioned, the CD4 T lymphocyte counts are low, or if the mother opts for vaginal delivery and opts to breastfeed the baby, then it doubles the risk of maternal to child transmission. Avoiding breastfeed in situations where we can ensure that the nourishment of the baby is not going to be compromised would be a good idea, because the virus is also transmitted through the breast milk.